Hi there. Well, thanks for joining us at the College of Nursing. We're just going to give a minute or so for people to join our broadcast, and then we'll get going. One minute. We'll give them 1 minute to join us. We'll just get going in about half a minute here. All right. Lots of people joining us, so we'll get started and we'll just do introductions first. So my name is Tyler Turman and I'm the coordinator and academic coach of the Pathway for Indigenous Indigenous Nursing Education to the PINE program. And I do recruitment within my colleague.
My name is Lauren Ivanchuk and I'm a student advisor for the nursing program as well as the midwifery program within the college.
Thanks. So I'm going to share my screen. And this presentation is the second part. So there was a presentation at 3 p.m. that talked about the skills and sort of the student life part of the College of Nursing. And now we're going to talk a bit about what it's like in the college, how to get into the College of Nursing, and a little bit more about nursing. So what we're going to talk about, what is nursing? Why choose to be a nurse? We're going to talk a little bit about student life and kind of a bit more of what we talked about in the last presentation. And then the majority, we're going to spend about pathway to nursing, also the PINE program, and also midwifery. So we do have a midwifery program that Lauren will speak to as well. So what is nursing? These are just a few funny, we do love humor. Humor is medicine as well. So here's just a few funny images about nursing. And a quote that I really like, and this really speaks to me as a nurse. And the quote says, "Nursing can be described as both an art and a science, a heart and a mind. At its heart lies a fundamental respect for human dignity and an intuition for a patient's needs." So in the previous presentation, you were asked to submit a word to a Wordle. So this was a previous Wordle that we had done, but she forgot to share this with you at the end, or we didn't share it, but we wanted to share it with you because the majority of you were probably in the last session too. So here are some of the words that were shared in that last session. So what does nursing mean to you? So it really is a lot about compassion, caring, helping others, caring for the marginalized, helping, careful, medicine, lots of very similar words as well. So a lot of characteristics of what it's like and what it takes to be a nurse. So nursing is a profession of caring. Caring and compassion are very fundamental to nursing. We also are a huge advocate for our patients. So sometimes your patients can't speak for themselves, whether they are, just coming out of surgery, whether they're a pediatric patient, or, an elderly patient who is not able to speak, or maybe they just don't have a medical background and they don't really know what's happening to them. So we as nurses are definitely an advocate for our patients. And diverse work environments. So many places that nurses work. So many people, the first thing many people think of, and if this wasn't virtual, we often will ask what kind of places nurses you see nurses in, but we're going to have a look at some of those places too. So the first place usually is in hospitals that we think of. So lots of different areas within a hospital that nurses work as well. So there's medical surgical, pediatrics, which is working with kids, labor and delivery, so delivering babies. We saw in the video in the last session, there was a video where they were doing a simulation where there was a birth happening. psychiatry, emergency department, and then there's so many specialty areas, just to name a few, like cardiac, neurology, burn units. So lots of different places within a hospital that you see nurses. But there's also so many other places, like nursing is such a diverse career. So we also see nurses in areas such as public health. So especially with COVID happening right now, there's public health nurses that are providing immunizations and doing the contact investigations as well. There's nursing stations. So in remote and isolated communities, they often have advanced care practice nurses working in nursing stations, personal care homes, there's home care nurses, and then working in the government. So whether that be in policy or military or anywhere that's government, whether it's federal, provincial, lots of different areas that nurses work in government. We also have, there's nurse practitioners. So they work independent and are able to prescribe medications. So nurse practitioners, we do have a program, a master's program within the College of Nursing, and we do educate you to become a nurse practitioner. Once you have your nursing degree, you can go on and become, do the Master's of Nursing program to become a nurse practitioner. I always put this on here because cruise ships, who would have thought there's nurses on cruise ships as well? So that's kind of a fun thing. Policy and primary care, and then there's education. So I am a nurse. I do have a nursing background, and I've recently come to work in education and to be able to help to educate the next generation of healthcare practitioners. So why choose a career in nursing? So this is a quote by Maya Angelou that I really adore, and it says that they may forget your name, but they'll never forget how you made them feel. And this resonates with me on why I chose nursing as a career, and where I came from, the community I was in, I didn't have, there was no hospitals. It was nurses that cared for us. And it was the feeling that you got from them. You felt comforted. You felt, you felt that warmth. You felt like they cared. And I just really admired that. And I thought, I really want to be able to give that back to other people in my career. So that is why I chose to go into nursing. So whether nursing is the path for you or you want to choose something else, always connect to that emotion, because it's going to really keep you in your career for quite a long time. So in the last session, they did, there was a few videos, and one of them was a tour of the Helen Glass Center that showed the simulations in the labs. And then they also showed a second video that was about, that talked a little bit more about the skills lab. So I'm not going to re-show the video because it was in the previous one, and they will be sharing these recordings so that you can watch them again as well. But here's, this is one of our skills labs and some of the things that we learn as nursing students. And here's just a few more images of the skills lab. But one thing that I want to remind you is that in the top left corner there, you'll see them taking tests, and this is still in the skills lab. So one of the really important things with nursing is your math skills. So some people may be really good at math, some people maybe not so much, but it's an opportunity to know now that you need to really pay attention to your math skills and study really hard, because math is really important in nursing. All those medications that we have to give, calculating dosages, calculating injections, everything, you're gonna need your math skills. And they also showed you in the video the simulation lab. So this is one of the, there's the mid-fidelity and the high-fidelity mannequins. And they can do so many things. So we learn on these in the simulation lab, we learn how to care for these patients. And like they said in the last session, it's not just about the physical tasks of nursing, it's about the emotional part as well. So how to deal with patients, how to talk to them, how to comfort them. These mannequins can cry. You can do injections on these mannequins. They have heartbeats. You can do CPR on them. So it's a real life situation. that we do before you go into your clinical placements. You do learn how to do a lot of those tasks and a lot of the emotional skills as well with the simulation mannequins. So I will pass it over to Lauren to talk about Pathway to Nursing.
Thanks, Kyla. So the College of Nursing, we are an advanced entry program. You would take these prerequisite courses while you're in University 1, or you can apply direct entry to arts or science. And as Tyla mentioned, math is super important, as well as your high school sciences. You want to make sure that you, biology is important, and the math credit. And 30 credit hours of pre-nursing courses are just listed here. So you would take biology 1410, biology 1412, microbio 1220. You take 9 credit hours of science electives, including 1 math, and you need 12 credit hours of social science or humanities electives. And you want to make sure that you have 3 credit hours of a written English completed as well. We're a competitive admission. We do have 2 intakes for nursing. 120 students are accepted each fall term, and 120 students are accepted each winter term. Entry is based on an adjusted grade point average of your 30 credit hours and your most recent 45 credit hours. Information about the AGPA calculation can be found in the applicant information bulletin as well if you wanted to take a look at that.
Thanks, Lauren. I'll do the next few slides on the PINE. So we do have a support program that's called Makwa Mashkakim. So this is the Pathway to Indigenous Nursing Education. PINE is the acronym for this. So if you are an Indigenous student who is First Nations, Inuit, or Métis, you can apply to PINE to have support with achieving those 30 credit hours of admission requirements. So you would apply through, say, University 1 or arts or which faculty you choose at the beginning to come into the U of M. And at that same time, you would apply to PINE so that you could receive supports. And what supports these are is academic, personal, and cultural supports. So we do provide smaller class sizes, tutoring, knowledge keeper in residence, and a support from an academic coach as well as counselor and student advisor. We also have the Nursing 1500 course, which is preparing for professional nursing education. And this satisfies one of your electives, or one of the electives for your 30 credit hour requirement. And once you do achieve the 30 credit hours, then we suggest that you apply under the Canadian Indigenous category to the College of Nursing. And for more information, you can email nursing@umanitoba.ca and they will put you in connection with us at PINE.
Talk a little bit about the Bachelor of Midwifery program. This is a new program that's starting in fall of 2021. Applications are open until April 1st for this first intake, but then we will have an intake each September. Similar to nursing, it is an advanced entry program, so you would complete your prerequisite courses in University 1 or direct entry from and Chemistry 40S, Applied or Pre-Cal Math 40S are necessary to begin the pre-midwifery courses. Biology 40S is strongly recommended. While you're in University 1 or another faculty, you will complete Biology 1410, Biology 1412, Microbiome 1220, Stat 1000, Chemistry 1100, Chemistry 1110, Native 3240 or any 1000 level Native Studies course level or higher, 3 credit hours of science electives, and 6 credit hours of social science or humanities. Similar to nursing, you also need to complete 3 credit hours of a written English, and I usually would suggest that students would pick a written English course that also satisfies social science or humanities. These are the entrance requirements for fall 2021, and just so that everybody heads up, chemistry has made some course changes. So previously it was Chem 1300 and Chem 1310, but beginning fall 2021, those courses will be changed. So the Bachelor of Midwifery has an intake of 6 students each September, and the application deadline is April 1st of the year you plan to begin the program. Our registration is open to Canadian citizens and permanent residents, with preference given to Manitoba residents, and we also have a Canadian Indigenous category. This is open to First Nations, Métis, or Inuit populations, and up to 3 spaces will be designated for Indigenous students who are Manitoba residents and who reside in Northern Manitoba. More information about this can also be found in the applicant bulletin. The Bachelor of Midwifery is a 4-year degree, and it's a total of 130 credit hours. This 130 credit hours includes the 30 credit hours of pre-midwifery courses. And once you're accepted into the program, you begin in year 2. The program must be taken full time, and the curriculum consists of theory, lab, simulation, and clinical-based courses. The Bachelor of Midwifery program works with the Access and Aboriginal Focus program. Eligible students can apply to the Access program for supports prior to being accepted into the Bachelor of Midwifery program. The Access program is for students who want a degree but may be facing barriers to successfully transition to and complete their degree. The HCAP program is specifically for Indigenous students, and the UMAP program accepts newcomers, Northern residents, and students from low-income families. The Access program provides resources for students who may need additional support as it relates to social, personal, financial, and academic. There's orientation, there's one-on-one advising, assistance with registration, study skills, exam prep, and there's emotional support offered through a counselor and free tutoring available. There's spiritual support, smaller class sizes, and cultural activities throughout the year. And for more information, you can visit Access's website, or you can use the phone number there, or you can send them an email. If you're looking for more information about the Bachelor of Midwifery program, please visit our website, or you can check the applicant information bulletin. You can also reach me by email, or you can schedule a time to meet for an appointment with me. My email address is just on the slide there. And as I mentioned earlier, these are the fall 2021 admission requirements. Always check back in the fall for the newest requirements for any program. Thank you.
Thanks, Lauren. So just a quote to leave you off with. This quote says, "Never give up on a dream just because of the time it will take to accomplish it, because the time will pass anyway." So this is a quote by Earl Nightingale, and it just resonates because once you come into nursing or the midwifery program, you're in year 2 of a 4-year degree. And, 4 years will pass regardless. So, it's such an investment in your future. So with that, we will have a look at the discussion board and see if there's questions. But we also encourage you to visit our booth, ask us any questions. There's a lot of information in the booth that you can access, and then you can have a chat with us. We're there till 8:00 p.m. tonight if you have further questions. And or you can email nursing@umanitoba.ca with any questions after the event if we haven't answered them for you already. So we will just have a quick check.
There's one student studying medicine after their nursing degree. So this is something you certainly can do. Medicine is a very competitive program as well. And the nursing program is a pretty busy program, so it depends on each student. And I don't know if you have anything to add, Tyla. I think it's individual. What I suggest is if you aren't sure which path you want to go in, then definitely having that nursing degree is going to give you that care and compassion and of the nursing degree, but also give you the skills base for furthering your career in medicine. So it may take you a while to get into medicine, so you can work as a nurse in that amount of time. Really good foundation. So it depends. Some people do just to get into for medicine, and I would suggest you go to their sessions or their booth as well. But having a minimum of a 3-year degree prior to applying to medicine. So this is a 4-year degree that would qualify you. And I think it's just about, you could always meet with an advisor
in medicine to ask about that, or in nursing to talk further about that as well.
There's another question here asking, I have a degree and am an international student but interested in studying nursing. Do I go through University 1? So if you already have a degree, you probably would apply to the Faculty of Science or the Faculty of Arts or another faculty. University 1 is only specifically for students who have less than 24 credit hours of post-secondary coursework. So you'd probably be looking at arts or science.
More questions here. So there was a question about nursing. Do you have to take chemistry for nursing? It is not a requirement for your nursing degree, as long as you have the minimum for your science electives. But chemistry for nursing is not a requirement, although it is for midwifery. There's also a question, are there clinical rotations? If so, how many and how long are they? So each term, when you come in year 2, up until you're graduating, there is a clinical rotation in each term. So you're starting off, you might be in simulation first, but then you're going out into clinical settings. So each setting corresponds, it's a concept-based curriculum. So what you're learning in your skills lab, what you're learning in your theory courses, you're going to be applying into your clinical setting. So you would start off in the older adult rotations, and then you would go into medical surgical rotations, and then there's options following that, whether it's in labor and delivery, in mental health, in there's different rotations. You do go through most of the rotations though, and then after you're finished all your coursework, then there is a 450-hour senior practicum. So that's a time when you would sort of choose an area that you're more interested in pursuing your career in, and you finish 450 clinical hours in that area prior to graduating.
Yeah, I see another question here. Can I take a 3-year degree in arts and then apply to the nursing program? So you certainly can, and you can complete your prerequisites for nursing while you're working on your arts degree, and you certainly can. We just sometimes suggest University 1 for students that are just coming in who know they want to come directly to nursing. But whatever path you decide to take, as long as you have the prerequisites when you're planning on applying and you're competitive, you can apply whenever you would like to nursing. Different U of M and Red River.
So I mentioned about how our curriculum is, and that's one of the main differences is that we have a concept-based curriculum. We're also an internationally recognized university. We have the BN program, so an undergraduate program. We also have a Masters of Nursing program as well, which has the nurse practitioner as well as streams of the Masters of Nursing. We also have a PhD program, so you can become a Doctor of Nursing in the College of Nursing.
There's another question, am I able to take a 4-year science degree and then my nursing? Again, you can. We don't have an accelerated program, so if you do your science degree first, you would still come in and need 3 years in the College of Nursing. And there is no limit on the number of times you can apply to nursing. If you don't get into one intake, you can apply to the next intake. There's no wait times in between, and there's no limit to the amount of times you can apply.
That's great. And there is no wait list with the College of Nursing. So if you don't get in the fall term, then you can apply for the winter term. So there's no wait list. It just depends on who all applies because it is a competitive admission process. There is a great question that asks about, for someone who's in grade 10, what should you be preparing for? And that's a great question. And my suggestion is just to focus on your math skills, focus on although biology is not required, it is recommended just because of the foundation that it helps to build. But yeah, just making sure that you have your required courses. And in order to be admissible to the University of Manitoba, I just recommend that you do go to university University 1 booth or to the arts booth, whichever faculty you're looking at applying for, just to make sure that you do have the admission requirements that are necessary. There's a question about support for finding clinical placement. So all the clinical placements are selected for you. You do get some input into them. You do get there is a form that you fill out about your top choices. They try to fit those the best they can, but sometimes it's not your first choice. But all the site selections are all done for you. Lots more questions here. We're almost out of time, so if we do not answer your question, please connect with one of us in the booth. There's 3 of us that are going to be there till 8:00 p.m. tonight, answering all your questions.
Yeah, I'm gonna just I'll try to quickly answer some questions in the chat here. Yeah. Recommended
GPA to get into nursing. So minimum of a B+ average. So 3.5 minimum is recommended, but 2.5 is what the required minimum is. But to be competitive in the College of Nursing, it's generally around a 3.5. It all depends on who all applies. Sometimes it's been as low as I think just over a 3, and sometimes it's been up to a 3.8 is the cutoff. So it all depends on who's applying at that time. And you can always connect with your home faculty to see if your GPA is competitive or what you need to do to bring that up. So there's a question about what do you need to be an LPN nurse? We do not have an LPN program. The LPN nurse program, there is one, I think, at Assiniboine Community College. Very, very different program. But yeah, so ours is a degree prepared program. You would achieve a Bachelor of Nursing degree. Yeah, you do not need pre-cal. You just need a 40S math requirement. Another great question: if you're queasy around blood, is nursing maybe a fit for you or not? It all depends on how queasy you are. There is definitely going to be blood in your nursing education. Whether you choose to do that in your future career or not is dependent on you, but there will be parts where you do have to deal with that during your schooling. And in terms of the U1 courses, there's the 30 credit hours pretty laid out for you. You can always connect with an advisor you can go to the University of Manitoba website, and on the website, there is a book an appointment with an advisor. You can book as a prospective student, and they can review with you the requirements and any suggestions there about the College of Nursing. And maybe there's one more question. And please connect. And yeah, be sure to check out the links that are in our booth because a lot of this is answered there. And you can find a lot of information there. Please email us at nursing@umanitoba.ca if you do have further questions, and connect with us in the booth. We're here till 8:00 p.m. and we'd love to hear from you. So I think with that, we're going to end this session, but we thank you for coming, and I hope you enjoyed both of our sessions today, and we look forward to seeing you in the College of Nursing.